As we age, something subtle yet powerful begins to happen inside our bodies. It is not visible at first, but it changes everything from how we walk, stand, lift a bag, or even get up from a chair. It is the silent erosion of our muscle strength, a process known in medicine as sarcopenia. Most people assume that muscle loss is inevitable after 60, that it is a normal part of getting old. But what if I told you that your body has a built-in mechanism to rebuild muscle faster than you thought possible, and it does not require a gym, heavy weights, or even complicated exercises? Yes, today we are uncovering what one top surgeon calls the one move that rebuilds muscles faster than the gym, especially for people over 60. A single science-backed movement that stimulates deep muscle fibers, improves balance, strengthens your core, and reawakens your body's natural repair systems, safely and effectively. Part 1. Understanding the problem. Why muscles disappear after 60. Let us begin with a simple truth. Muscle is life. Your muscles are not just for lifting or looking strong. They control your metabolism, protect your bones, and even regulate your hormones. However, around age 60, most people lose about 3% to 5% of their muscle mass per decade, sometimes faster if they are sedentary or have poor nutrition. This is called age-related sarcopenia, and it affects more than 50 million adults worldwide. You may notice it in small ways. Climbing stairs feels harder. Lifting groceries strains your arms. Your balance feels weaker. You get tired faster after simple activities. What is happening inside your body is both fascinating and concerning. When we age, our muscle fibers shrink. The mitochondria inside cells become less active, and our nerves that signal muscles to contract start degenerating. Even if you eat the same amount of protein or move as before, your body cannot process nutrients as efficiently. Hormones like testosterone, growth hormone, and IGF-1 also decline, reducing your muscle-building signals. And because of this, many older adults enter a dangerous cycle. Less movement, more muscle loss. Less strength, even less movement. This is the muscle spiral that slowly steals independence in the later years. But there is good news. The decline is not irreversible. Part 2. The Science of Muscle Rebuilding. After 60. Here is what many people do not realize. Your muscles never lose their ability to grow. They only become less responsive, but with the right stimulus they can still rebuild, even at age 70, 80, or beyond. Research from the University of Birmingham and Harvard Medical School shows that older adults can rebuild lost muscle just as effectively as younger people, if the muscles are challenged in the right way. The trick lies in a specific type of movement, one that activates slow twitch and fast twitch fibers together, increases blood flow, and stimulates the release of myokines, natural muscle growth messengers. This secret move does not rely on heavy dumbbells or fancy machines. In fact, surgeons who work in rehabilitation medicine have observed that patients recovering from major surgeries often regain strength faster with controlled full-body tension movements, rather than typical gym training. Part 3. The move. The wall sit. So, what is this move that rebuilds muscles faster than the gym for people over 60? It is the wall sit, a simple static exercise that activates more muscle fibers than most traditional movements, yet puts zero strain on the joints. Let us break it down. How it works. The wall sit involves holding your body in a seated position against a wall, without an actual chair. It engages your quadriceps, hamstrings, glutes, core, and calves simultaneously. But the real power lies in what happens inside your muscles during this hold. When you hold a static position, your muscles experience isometric tension, meaning they contract without changing length. This sends a powerful signal to your brain and body. We need more strength here. Your body then releases growth factors and increases circulation to those muscles, leading to regeneration and hypertrophy, muscle rebuilding. Studies published in the Journal of Strength and Conditioning Research show that isometric exercises like the wall sit can boost muscle endurance and growth up to 20% faster than dynamic movements for older adults, especially when performed consistently. Part 4. Step-by-step guide to perform the wall. Sit safely. Step 1. Find a wall. Stand with your back flat against a sturdy wall, feet about 2 feet away, shoulder width apart. Step 2. Slide down slowly. Bend your knees and slide down until your thighs are almost parallel to the floor, as if sitting in an invisible chair. Do not go lower than your comfort allows. For most seniors, a 45-degree knee bend is sufficient. Step 3. Engage your core. Tighten your abdominal muscles. Keep your back pressed firmly against the wall. Your shoulders, hips, and head should be touching the wall at all times. Step 4. Hold the position. Start with 15-20 seconds, then gradually increase to 1 minute or more as your strength improves. Step 5. Breathe deeply. Do not hold your breath. Breathe slowly and steadily throughout the hold. Step 6. Come up gently. To finish, slowly push through your heels and return to a standing position. Rest for 30-60 seconds and repeat 2 to 3 times. Part 5. Why the wall sit works so effectively for seniors. Now you might ask, why does something so simple outperform gym workouts for people over 60? Here are the key physiological reasons. Joint safety. Unlike squats or lunges, the wall sit involves no rapid motion, eliminating strain on knees and hips. It is perfect for those with arthritis or joint pain. Deep muscle activation. Isometric. Part 7. The role of recovery and rest. Older adults often believe more is better, but in muscle building, recovery is just as vital as exercise. Muscles grow not while you are moving, but while you are resting. During sleep, your body repairs micro tears in muscle fibers, building them back stronger. Aim for 7-8 hours of quality sleep nightly. Avoid long sitting hours. Gentle stretching between activities helps blood flow. A 10-minute nap or relaxation breathing can improve recovery by reducing stress hormones like cortisol. Part 8. Advanced variation. The wall sit pulse. Once you are comfortable with basic wall sits, you can introduce the pulse technique to accelerate results. In this version, instead of holding perfectly still, you slightly move up and down 2-3 inches during the hold. This dynamic tension increases blood flow and engages stabilizing muscles even more effectively. You can also add light hand weights or press your palms together for extra core engagement. Performing this 3 to 4 times per week for just 10 minutes can trigger noticeable muscle rebuilding in as little as 30 days, faster than most traditional gym regimens. Part 9. Real-world results and medical evidence. Multiple clinical studies confirm the power of isometric exercises like the wall sit for older adults. University of Tokyo, 2022, found that daily wall sits improved leg strength by 24% and reduced knee pain in participants aged 65-80 within 8 weeks. Harvard School of Public Health, 2021, observed that seniors performing isometric holds 3 times a week had 30% lower fall risk and better glucose control. Johns Hopkins Rehabilitation Center, 2023, concluded that static muscle tension exercises accelerated post-surgery recovery by up to 40%, especially in hip and knee patients. This is why many orthopedic surgeons and physiotherapists now recommend wall sits as part of post-operative care and anti-aging fitness programs. Part 10. Avoiding common mistakes. To get the most benefit safely, remember these points. Do not overbend your knees. Keep them above your ankles. Do not hold your breath. Steady breathing maintains oxygen flow. Do not push through joint pain. Mild muscle burn is good, but sharp pain means stop. Do not train daily at max intensity. Rest days are essential for recovery. Part 11. The psychological edge. Strength building after 60 is not just about muscle. It is about mindset. When seniors regain physical power, something changes in their confidence, posture, and independence. Daily activities feel easier. You stand taller. You begin to believe in your body again. That is the hidden reward of this simple exercise. It is not just a movement. It is a statement. I am not done yet. Even 5 minutes of focused effort each day can transform your energy, balance, and mood. Part 12. Complementary exercises. While the wall sit is the one move that delivers fast muscle rebuilding, combining it with a few light activities can multiply the benefits. Chair squats, to gently train functional movement. Calf raises, improves ankle strength and circulation. Resistance band rows, strengthens back and posture. Standing marches, enhances coordination and blood flow. Perform these 2 to 3 times weekly, along with the wall sit, and you create a complete muscle maintenance program for life. Part 13, the 30-day challenge plan. Here is a simple routine to apply this knowledge practically. Week 1, wall sit, 3 sets of 20 seconds each, 3 days per week. Week 2, increase hold to 30 seconds. Add 1 more set. Week 3, hold for 45 seconds. Introduce pulses for extra activation. Week 4, hold for 60 seconds per set, 4 times per week. By the end of 30 days, most seniors notice improved leg strength, better balance when standing or walking, less joint stiffness, higher energy and confidence. Part 14, medical disclaimer and safety note. Before starting any new exercise, always consult your healthcare provider, especially if you have chronic conditions like arthritis, heart disease, or balance disorders. Use support or a wall corner for added safety if needed. This movement is gentle, but safety must always come first. Part 15, final doctor's advice. To every person over 60, listening right now, remember this. Your muscles are not gone. They are waiting to be reawakened. Even if you feel weak today, your body still holds remarkable power to heal and rebuild. Do not let age be your reason to stop moving. Let it be your reason to start smarter. You do not need a gym. You do not need heavy weights. All you need is a wall, your body, and a few minutes a day. This is how you rebuild not only muscle, but life, strength, and confidence. So today, stand tall, find your wall, and take your first step toward a stronger, healthier you. Because age is not the enemy. Inactivity is.